Okay, good evening. My name is Dr. Jack Lambert, and I'm representing the Lyme Resource Centre, which is a charity that's been established in Scotland, kind of focusing on education, training, and research for tick-borne infections. As a matter of introduction, I'm currently a Scottish-born infectious disease specialist working in Dublin, Ireland as a professor of infectious diseases. And over the last number of years, I've started seeing a number of patients with tick-borne infections, specifically Lyme disease. And some of these patients are newly diagnosed with a recent infection, and a number of patients are diagnosed with longer-standing infection. Either way, I think tick-borne infections are increased worldwide, and what we're doing here in the midst of COVID is just trying to present some education and training sessions, small bites for GPs based on questions that have arisen from both doctors and patient groups regarding this infection. So first off, I'd like to go through a series of questions regarding tick-borne infections, Lyme disease. The first question being, what is Lyme disease and where did it come from? The reality is Lyme disease has been around for centuries, not recognized as such, but ticks have been around for centuries. And I recently visited Central America, Belize, and one of the most famous ruins in Belize is called Tajalpec, which means the field of ticks. So ticks have been around for centuries, dating back to the Aztecs and Mayan ruins, but not known as the same. The first recognition of Lyme disease in the Western world goes back to 1975 in a town called Old Lyme, Connecticut. And this was an interesting investigation that was started by researchers from Yale University and also for the Centers for Disease Control, because in Old Lyme, Connecticut, they had a cluster of what they thought was juvenile rheumatoid arthritis, which was reported to the public health officials. However, juvenile rheumatoid arthritis is a very rare condition, and the number of children in this particular locale, Old Lyme, Connecticut, just north of New York City, had an incidence of juvenile rheumatoid arthritis much higher than would be expected. The investigations then done by the Yale researchers, including a Dr. Alan Steer from Yale University, the Division of Rheumatology there, he described then a condition called Lyme arthritis. And it wasn't clear whether it was an infection or whether it was some kind of an immunological or other condition, but this was the beginning of our modern understanding of Lyme disease, named, as I said, for a cluster of children who developed this unusual arthritis, migratory arthritis, in Old Lyme, Connecticut. So in 1977, it was recognized that this was caused by transmission from a tick-borne infection. And in 1981, the bacterium Borrelia was identified by a Swiss-American medical entomologist whose name was Billy Berdorfer. And he was working with the CDC tick-borne pathogens group, which are located in Fort Collins in Colorado, United States. But he was the first one then to identify, on taking samples of the blood, that indeed the bacterium causing Lyme disease was Borrelia, which is a spirochete. And subsequently it was named after Willy Berdorfer and then called Borrelia berdorferi. Willy then went back to Switzerland and found that the Swiss sheep also carried these ticks. So there you go, the beginning of an investigation to put together the relationship between ticks, animals, and humans who were infected by these ticks. So Borrelia berdorferi is a spirochete. Classically, we think of deer, and indeed in Old Lyme, Connecticut, there were lots of deer in this suburban, wooded area north of New York City, but also we've discovered that many animals harbor ticks. not just deer. So geese carry ticks, squirrels carry ticks, mice carry ticks, rabbits carry ticks. So lots of different animals are carrying ticks. Those ticks then dislodge themselves from the animals, go into the grass. If you unfortunately are walking through the grass, the tick will then jump onto you and bite you and potentially inoculate you with the bacteria Borrelia burgdorferi. So since this discovery in 1981 of the bacterium Borrelia burgdorferi, we've learned a lot. We've learned a lot about this infection, but there's still limitations in our knowledge. So for example, in adults, the ticks primarily bite adults on the legs and the arms, but in children, they're more likely to bite on the torso and the head area. The ticks burrow into moist, damp places, for example, behind the ears, the knees, the groins, and the armpits. And these bites, as a rule, tend to be painless. They're not like the bite of a spider or the bite of a bee or a wasp. They tend to be painless. The challenge then is, do you identify a tick? The size of a tick is not the size of a bee, it's the size of a sesame seed. So many people will not recognize a small black speck on their skin. If you're lucky enough to identify a tick that's been on your body and engorged with blood for a period of days, if it's on your forearm, you might notice it. But if it was on the back of your leg, if it was in the by your belt line on your back, if it was behind your neck, if it was on your scalp, you would not necessarily identify a tick. So while people commonly think that you must identify a tick as part of this disease, most people do not recognize a tick as part of this infection. So the critical part is to have the history. If you're in Old Lyme, Connecticut, where actually up to 70% of the ticks are positive for Borrelia, and you have a child who develops joint pain, the very first thing that should be on your mind is a tick-borne infection, including Lyme disease. So this is the challenge. Tick-borne infections are ubiquitous all over the world, not just Old Lyme, Connecticut. And there's lots of places within the European Union, North America, and worldwide that harbor ticks. And anyone in the right season can be at risk for tick-borne infections.